Danny Mortimer is Chief Executive of the NHS Confederation. It represents organisations that commission and provide NHS services. Danny, can you tell us whether there is a kind of a national template for how you're meant to organise these second bookings, just to make sure people are not lost after they've had one?
Good evening, Evan. Just to start with, I am sorry. Our members will be sorry for the kind of confusion and concern that's been caused to members of the public and to our colleagues. Many of the examples that you shared there are as a result of the change in policy to prioritise the first dose. Before the end of December, we had a policy where people would be rebooked for their second dose within 4 weeks, and that's been changed to 12 weeks, so we can prioritise the first dose for everyone. I think, and there are different systems in play as a result of that. The assurance I can give your listeners is that there is a national system that lies behind this in terms of tracking the bookings for the priority groups that have been identified. And if people haven't heard about their second appointment yet, and if you're being vaccinated this week, your second appointment is likely to be in April, you will be contacted, though there are also lots of examples where people, particularly if they've gone through the mass vaccination centres, are booking the two appointments together. But we do have 3 different ways of delivering the vaccine, and people will choose the way that's most convenient for them, and that's adding a certain amount of complexity as well.
So you're telling me, but I just want to be 100% clear, if you've had a first vaccine, the system somewhere, whether you got it through your GP or whether you went to a mass vaccination centre, the system knows the date and what the vaccine you have had is, and will make sure that you are contacted for a second one before 12 weeks.
Yes, it will. The system will do that.
Now, the system, and this I'm again drawing on my father's experience, the system books the second dose quite close to the 12-week deadline. It's not like they said, let's do it after 9 weeks, and leave a bit of slack in case you're ill or can't get in that day. It's like 11 and a half weeks is your second appointment. Is that a very safe way of doing it?
I'm not a clinician, Evan, and I'm in particular, I'm not an expert in terms of the vaccine. The very clear message our members have been given is that we must prioritise the first dose, and that the country wants as many people as possible to get their first dose, and absolutely that the system will guarantee and ensure that people do get booked then for their second dose. Yeah. We have. There are other concerns that are coming up as well, and you've touched on some of those in your introduction as well. I mean, the biggest challenge at the moment is that there isn't as much certainty and consistency of supply of the vaccine as people working in the NHS would like. But again, we know that the government and the manufacturers and the regulator are working on that, and they tell us that will improve in the coming weeks. But the system for booking, we are assured is robust and will offer people those second appointments.
And I suppose the nightmare is that someone at 11 and a half weeks is due a second dose of the Pfizer vaccine, and it's, this week we don't have enough Pfizer vaccine to give people their second dose, and then they're getting over the 12 weeks, which is already quite a stretch. Are we sure is someone tracking the supply to make sure there is going to be the supply for the second doses so that people are not pushed over 12 weeks?
No, and our colleagues in the service, particularly the general practice teams that are, doing a lot of the heavy lifting in terms of this vaccination programme, have asked us to seek that assurance as well. And the assurance we've been given by NHS England and by the authorities in Wales and Northern Ireland is that, yes, they've planned the supply to make sure that there is the specific vaccine that's required.
But aren't the Welsh holding some back? So there is some that they can be using on those.
I think the Welsh government have said some slightly different things around that, but the assurance that we've been given across the three countries that we work in is that there is absolutely that planning that's taken place, because of course if you've had a first dose of the Pfizer vaccine, you have to have a second dose of the Pfizer vaccine. First dose of Oxford AstraZeneca, you have to have the second dose of Oxford AstraZeneca, and yes, there is a very high degree of confidence that we've been given by national authorities that those supplies will be available at that 12-week point.
You've been reassuring, Danny. Danny Mortimer, Chief Executive of NHS Confederation.